Okay, so let's look at the role of autism and autoimmunity. And if you really haven't heard or you don't know somebody with autism, or not with autism, but with autoimmunity, we'll hold off on the autism for just a second. But autoimmunity by itself is kind of a broad term, and if you don't know anybody that is suffering from an autoimmune condition, then you're probably hiding in a cave, because this sector of healthcare and the dysfunction around autoimmunity has exploded for numerous reasons, which I'm going to point to a few of them as we go through this. But this is something that it seems like in my practice, almost every time I turn around now, I'm catching somebody with some type of autoimmune dysfunction. And the effects of it are very broad in nature, because it really depends on how that immune dysfunction starts to present itself, but its effects are pretty profound. So let's kind of start working through our presentation here. So first, before we get going, let me kind of give you what my objectives are that I want us to cover tonight. First thing I want to do is I want us to identify a solid, clear connection between autoimmunity and autism. And I want to do that not just with the autoimmunity as it relates to the child, but I also want to do it with autoimmunity as it relates to the mother, right? And I don't want any of you mothers to walk away from this feeling guilty tonight. That is not my intention whatsoever, okay? So let me just lay that out there. My intention is to give you this information to show you how to better support your children, okay? Because we can learn from ourselves to help children as well, okay? And that's my intention by doing this, all right? I want you to understand how this whole autoimmune presentation kind of builds itself and how it ends up creating symptoms. We want to look at kind of the broad impact of autoimmunity. Some of you that have been around this environment for a little while now, you're used to seeing things like gastrointestinal tests. You know, there's a lot of talk about gastrointestinal dysfunction, discussion about different food allergies, things of this nature, how they affect autism. I want you to kind of get the bigger picture on this as we go through it. We'll look at some of the triggers. And then it's great to know all this stuff is out there, but you got to know how to intervene in it too. It doesn't really do you any good to know it and not know what to do with it. So we're going to talk about what to do with it. And then again, we'll kind of back out and look at the bigger picture and really kind of suggest how do you look at autoimmunity in terms of treatment protocols that you have seen in the past and that you haven't seen yet, which I'll introduce you to as we talk through this. So it really helps so we're all on the same page, to have some standard definition of autoimmunity. All right? So let's just look at these. It's a misdirected immune response that occurs when the immune system goes awry and attacks the body itself. So the immune system is a very efficient system. And if it sees a bacteria or a virus, let's just use one of those two examples right now. Think about how you feel when you develop a cold. Again, bacterial, viral here. You feel worn down. What the body's doing is it's redirecting all of its resources not towards energy production for you, but towards energy production for the immune system, so it can overcome whatever that immune challenge is. The problem is that if the immune system loses the ability to recognize something as foreign and it starts seeing you as foreign, then it's just as efficient and it'll start attacking you as well. Okay? So we want to understand that there's a difference between the body being able to recognize self versus being able to not recognize itself anymore, okay? And autoimmunity is evidenced by the presence of autoantibodies. You could put autoantibodies/antibodies there. That's just antibodies is kind of the catchword in this whole autoimmune situation here. And T cells, which are just your immune cells that are reactive with host antigens, okay? So a host antigen, think about that as the bad guy. That's your bacteria or virus. That's the thing that should not be in your body. That's non-self, okay? So that's what the immune system is reacting to. So in terms of autoimmunity, we want to think about this as it relates to autism. We want to think about it as a completely new paradigm, right? It's, at least in my exposure, it's not really being talked about a lot. It's kind of this evolving thing right now. And I want to show you where this evolution is kind of taking us. But look at what this information says. It talks about The scientific evidence is quite credible for autoimmune hypothesis leading to the identification of autoimmune autistic disorder. All right? And notice what this says. It's a major subset of autism. All right? So it's being recognized that what we have come to think about as autism, the dysfunction that surrounds that, is driven by an autoimmune process in the large majority of individuals that get labeled as autistic. Okay? And just to kind of further drive that point home a little bit here, you get this elevated immune response in the brain of autistic patients. Okay, well, we're going to talk about this not just in terms of brain tissue, but in other areas of the body as well, and other areas of the nervous system. But you'll notice with this that it's an elevated immune response. So the immune system is heightened in its response, it's identified something that's wrong, and it's going after it. Okay? And what this says is that localized brain inflammation and autoimmune disorder may be involved in the pathogenesis of autism spectrum disorder. So what we typically think about as being autism is an autoimmune condition, is what this is trying to say. Okay? Well, it's what it is saying, it's not what it's trying to say. So let's look at this new paradigm, and let's kind of make some tighter associations with this link between autoimmunity and autism here. And again, I want to point out as I go through this, these dates that I've got up here, you'll see that there's a date associated with each one of these. Notice how current these dates are. They're all pretty recent publications here. So this is looking at the relationship between anti-neuronal antibodies and a neuron, that's your nerve cell, right? So what this study is specifically looking at is the immune system's attack on nerve cells, okay? And it's looking at them in the brain here. But what you're going to see here is that these anti-neuronal antibodies, so the attack against the nerve cells, has a significant correlation to the severity of autism. Okay? So as these antibodies go up, the severity of the autism goes up. Right? Those of you that have been around autistic kids, do you notice that they kind of go through periods of exacerbations and then not quite so bad, and then it gets worse, and it's not so bad, and you're like, well, what did I give them? What changed? What did I do different in their environment? I mean, it's everything is exactly the same. This is what's different, or this is at least one of the factors that's different. I can't say it's all this, but this is at least one of the factors that's changing. These antibodies start climbing up, and the dysfunction in the nervous system becomes heightened. That level of inflammation in the brain continues to get worse for them, and then it comes back down depending on what the trigger form is. And we'll talk about some of those triggers as we work through this. Here's another one. This was looking at what are known as ribosomes in the cells. And these are different proteins. Your ribosomes produce proteins in the body. All right? So specifically looking at some of these neurological related proteins. But look at what this says. Elevation in those antibodies significantly correlated to the severity. Okay? Here's another one. This is kind of the hot topic right now, mitochondria, right? So if you fix the mitochondria, it gets better. So how do you fix the mitochondria? You give your lower B vitamins like your B1, your 2, your 3, your 5, things like magnesium, iron, all that stuff helps in the mitochondria. But you know what none of that stuff does? It doesn't do anything to control or regulate the immune system. So you can have all the nutrients sitting there to support the mitochondria and still have mitochondrial dysfunction because now the immune system has targeted that and it's going after it. And the mitochondria are the areas in the body that produce energy. They're the little energy powerhouses in the cell, if you will. So, it's definitely important to look at this from a nutrient aspect, so you make sure that you're giving those mitochondria every potential support that you can. But you also have to think about, well, is there an immune relationship to this as well? Because again, just looking at replacing those nutrients may not get the job done. And then this particular protein, these gangliosides. You guys ever heard about, or you're probably familiar with this, knowing about the brain and the ability of the brain to adapt? They call it plasticity. So, think about plastic. Plastic has a flexible nature to it. They've kind of likened that to the brain, and the brain has a flexible nature to it as well, in that it can adapt to different situations and scenarios over time. With this particular protein here, this ganglioside, and there's a couple of different gangliosides, but this is one of the proteins that helps the brain be more plastic, helps it adapt, helps it overcome, right? But look at this, you can develop antibodies to those as well. Significant positive correlations with the degree of severity of autism. Right? Do I sound like a broken record yet? Okay. And here's just a couple more. These are just, when I ran my literature search and I was putting this together, these were just some of the different antibodies that kept popping up. Right? So I wanted to share these with you to show you that it's not just one little region in the body that's getting attacked, it's the whole body can get attacked. And I'll explain to you as we go forward why that is and why it's different from person to person to person. Right? Because think about it, if you had to go chase down every single one of these antibodies, there's tons of these that can be in the body. It's almost a futile effort. But look at this, the nucleus, so the very core of the cell, and the myelin, so the insulation or the insulative coating around the nerves. That's what we're talking about here. Now, we've been talking about antibodies, but now we're going to talk about the chemical messenger. So this is the other little piece of the puzzle that you need to know. So if you look at this, you're going to see that it says autoimmunity to brain tissue may play a pathogenic role in autism. Okay, so that's kind of what we were already established. And then it says this interleukin 17 is a pro-inflammatory chemical messenger that has been shown to play an important role in various autoimmune neuroinflammatory disorders or diseases. So this is the bad guy. This is kind of there's a couple bad guys in this, all right? But this is the one that gets targeted a lot. This is the one, and I'll show you a study with evidence of this. This is the one that if this guy starts elevating and taking off, then there's an autoimmune process at play. It's moving forward, it's damaging tissue in the body somewhere. Not just neurological, but some tissue in the body is getting damaged by an autoimmune process if that interleukin or IL-17 starts elevating. Okay? But again, we can do something about that. So, should we pay attention to this? And here's what this says. Its levels are significantly correlated with the severity of autism. So that's the reason I put it up there. So it ties right into these antibody elevations. So if the antibodies are going up, IL-17 is going up. Right? So what's our common theme? The worse those two are, the worse your severity is going to be. Down. Now, how does all that get kicked into motion? That's what we got to know, right? Because that could be a potential avenue for us to intervene and to do something. Because if we've got a constant trigger, then we can potentially eliminate that trigger from the environment. And that way, the immune system is not targeting that trigger anymore, and the stimulus to continue to drive that immune process is not there. And if it's not there, then it's not going to keep attacking the tissue in the body. What happens in these scenarios is that whatever the trigger is, some of these things that we're going to talk about here, whatever that trigger is, your body goes through this process known as molecular mimicry. So think about just mimicking, right? So what will happen is the protein structure of whatever the trigger is close enough to a protein structure somewhere in your body that your immune system can't differentiate between the two, and it starts attacking that. So it went after whatever this outside trigger was, and because your immune system couldn't differentiate anymore, it says, well, that tissue in your body looks pretty close to what that trigger over there was, so I'm going after that too, just in case. I'm going to eliminate that one as well, because I'm not really sure. So it goes after both of them. So let's look at a couple of things here, and as I'm starting to go forward from here, I want you to think about some of the things that you've been exposed to in the past that are functionally related. Things like the heavy metal testing, like the neurotransmitter testing, the gastrointestinal function test. I want you to think about some of these things that you've heard in the past and kind of look at it in a little bit different perspective as we talk about some of these findings here. So what this says, and this is looking at prenatal stress or perinatal stress and brain inflammation. While insufficient development of the gut-blood-brain barriers could permit exposure to potential neurotoxins, okay, so those barriers in our gut, you guys have heard people talk about leaky gut, right? So leaky gut, things are getting through the gut that shouldn't be there. You can also have the same thing, the same barrier in the brain. The same proteins that hold your gut cells together also hold the barrier around your brain together as well. Ironically, they also hold the barrier around the lungs together as well. So if you think about in terms of upper respiratory tract infections, things like that, those could be some of the same reasons that the dysfunction in the gut is occurring, some of the same reasons that they're having the infections in the chest as well. But there's a breakdown in these barrier systems is really what I want you to get at here. So circulating autoantibodies against fetal brain proteins in mothers is associated with higher risk of autism and suggests disruption of the blood-brain barrier. Okay, so you got two things here. There's potentially the antibodies from the mother, and there's also disruption of that barrier around the brain. And what's causing that disruption? What's causing those antibodies, and what's driving that disruption of that barrier system? Well, you'll see I've got highlighted here, there's allergic factors to this. So if you look at, one of the things, of course there's the environmental, that's the more traditional allergic reaction here. But then you could also put here allergic/sensitivity, because everything that we've talked about, even things that I know that I've talked to you guys about here in the past, that's all related with the gluten, all the different subsets of gluten, the different grains. That's that whole category right there. The casein from the dairy, that's what we're talking about in that category, okay? And then you've got your environmental. So now that's all your heavy metals. That's all your toxin exposure. And we actually shouldn't say just heavy metals really anymore, because what I'm seeing in some of the reports that I'm running with patients is that some of your industrial chemicals are showing up. Like I did one last week, a review for he's 7 now, and he was showing up with petrochemical byproducts that he was reactive to. So it's not just heavy metal, so we can't just look at the heavy metal test and look at that as being the end-all be-all right now anymore. And even sometimes, I know in my clinic, when I do look at the heavy metals, I look at it from more of a immunological perspective sometimes than I do just as far as, are they building up in the system and do we need to be eliminating them? Right? So the whole chelation process. And I'm not saying that chelation is not necessary, so don't misunderstand what I'm saying. I'm just saying you got to really determine, is it the reaction of the heavy metal in terms of creating inflammation, or is it that the heavy metal is driving the dysfunction of the immune system that's creating the inflammation? Okay. And then your infections. So the strep infections that tend to come up fairly frequently. Okay, so those can be driving this. One of the ones that's pretty highly correlated are viral infections. I haven't read anything that really looks at which viruses. I'm sure that somebody's out there doing research on that, but I just don't know which ones those are. But the viruses are a big thing that they feel like are driving the dysfunction in the immune system as well. And then you get your stress-related triggers. So really with your stress, you're just breaking down the overall barrier systems in the body. So that leaky gut, as an example, becomes more prevalent in a higher stress state. And what do these do? These contribute to brain inflammation in the autism spectrum disorder here.
Excuse me?
Sure.
You were talking about pregnancy and about the mother. Are you referring to like these allergic, the environmental, the infectious, stress-related, each of these different triggers? Are you speaking only in terms of the child in this case? Or are you talking about the mother during pregnancy maybe having a role in that? Like at this point here, are you talking about the parent or the child?
Right, so your question is, who's being affected by these triggers, right?
Yes,
and the answer
where
is both.
Is it coming from?
It's both.
Right.
The answer is both, right? Let me go through a few more studies, a few more slides here, and let me see if I give a little bit more clarity to your question. And if I don't, re-ask it again. But the short answer to it is that these triggers drive autoimmunity in the mother and in the child. So, what I want you to see is as we're going through this is that it's almost a perfect storm scenario where you've got to have a couple of things that all come together at the right time to drive the inflammatory or that neuroinflammatory process that may lead us to autism or anywhere on that spectrum, whether it's PDD or whatever it is. There's a couple of things that just have to all manifest around the same time with each other. And actually, what I'm going to do at the end of this is one of the more controversial topics within the autistic community. You guys pretty much all know where I'm going with this. Is I'm going to give you a little bit different perspective on that. Okay. So let's look at one of these infections. This one was actually paratuberculosis, so a tuberculosis infection. But look at what this says. This molecular mimicry is the proposed mechanism that's thought to trigger these autoantibodies. So it's the immune system, in this case, the immune system sees this bacteria, it develops a response to it, and the reason what it does is it develops new cells, and those cells can go out and recruit other cells. But then it develops memory to it. And as it develops memory, it's ingrained. So when it sees that same protein strain come back around again, it's going to react to it. It's going to initiate an inflammatory response. And to discuss the immune system and to discuss inflammation, to talk about those two independent of each other is very difficult. Because what the body does when it develops an immune response is it's really developing an inflammatory response. And inflammation in and of itself is not a bad thing. Uncontrolled, prolonged inflammation is a bad thing. That's when it gets to be problematic. Okay? So the immune system's doing what it's supposed to be doing from the get-go. It just loses control in the long term here. So this one is actually looking at a few of the other triggers that we kind of touched on a little bit, but just to kind of point out a few here, you've got your different bacterial, you've got your dietary, so these are the two that have gotten a lot of attention, the wheat-based products or grains, and then your casein from your dairy, and then your thimerosal from your mercury. But look at this in terms of the thimerosal for a minute, because really what they're saying with this is it's not the mercury toxicity per se, it's the mercury causing an elevation of these autoimmune antibodies here that's driving this. That's what this is saying. Okay? And then if you kind of go a little bit further in here, and this is the perfect storm scenario, in individuals with predisposing HLA molecules. So those are molecules on your immune cells, on your lymphocytes. Okay. So if you have that HLA molecule, which is, there's a genetic correlation to that, whether or not you have some of these, but if you have those and you have exposure to these triggers, now you're possibly going to run the risk of developing autoimmunity here. So let's look at this maternal connection. So what this is saying is that the maternal antibodies, specifically the immunoglobulin G, are passed from the fetus to provide passive immunity throughout much of pregnancy. Okay, so as that fetus is developing in the womb, the mother is passing along these antibodies so that when the fetus comes out, it has some semblance of an immune system, right? So we want the mother to pass these things along. The problem becomes, what happens if the mother, through this process, develops some type of autoimmune process? What if she develops these autoimmune antibodies? Well, here's what this says, that both protective and pathogenic autoantibodies have equal access to the fetus. So if you can get the desirable ones across, you can also get the non-desirable ones across, because the basic molecular shape and structure of them is not that much different. They're basically the same. And just to give this a little bit more detail, if the mother has underlying autoimmune disease or has reactive fetal antigens, autoantibodies produced before or during pregnancy can target tissues in the developing fetus. But again, look at what this is talking about. It's looking at these barrier systems. So these barrier systems are key, and as we kind of move towards the end of this presentation, I want to get these barrier systems become really important in that discussion about leaky gut. And what we've typically thought about as how we look at leaky gut, What we now realize about that is that while that information is still extremely relevant, it doesn't really tell us, those tests don't really tell you whether or not leaky gut is truly there. They give you an insinuation that it's there. You can indirectly assume that it's there, but you can't definitively say with certainty whether or not there's a leaky gut scenario. But I'm going to show you how you go about doing that now. And it really comes back down to these antibodies. And again, I felt bad even putting some of these slides in here because I didn't want anybody to feel guilty about me doing that or about the information or anything. But what I wanted you to understand is that if you can, and I personally have the fortune of being able to work with a local pediatrician, and this is one of the reasons that he and I are working together. I'm actually seeing the parents and he's seeing the children. And what we're doing is I'm taking the information that I'm finding with the parents and we're taking it back to the table on the treatment side with the pediatrician, and we're seeing how much improvement or how much faster we can make the improvements in those children and how we can streamline those treatment protocols by knowing what the parents have passed along and what considerations do we need to make in setting up a treatment protocol for these kids. You know, do they have a higher predisposition for development of these autoantibodies? We need to know that information. So, you know, that's really the reason that I bring this stuff up. So, you know, if a mother, like some mothers know that they have a grain issue, well, if they know, you know, just as an example, if they know they have that, then without question that kid should not be consuming grains. Right?
Does autoimmune disease, doesn't that include the whole category of fibromyalgia, chronic fatigue syndrome, or is that a different?
It's different.
That's a different.
That's a different problem. That's a different set of dysfunction in the body.
Okay.
But we can talk about that if you would like at the end. But that is a different set of
I just wasn't
dysfunction.
sure I heard about that it was one of the same.
Well, and here's the issue with that. So the question was, you know, is fibromyalgia or chronic fatigue or those autoimmune presentations? Well, not as they're traditionally known. So I'll give you an example. Fibromyalgia is a processing disorder. True fibromyalgia is a processing disorder in the brain and how you process pain presentation. But the issue with this is that, and the reason I don't make a definitive statement on this as no, it's not autoimmunity, is because some of the things that we once thought as not being autoimmune have an autoimmune aspect to them. So while that may not, the autoimmunity may not be the entire driving factor, it may also be part of the factor that's driving the state of dysfunction. And just so you guys can kind of have a snapshot here of some of the things we've talked about all in one slide, these are the different antibodies as it relates to the neurological tissue that we've talked about that we had those studies for. So brain tissue, just general brain tissue in general. And then this myelin basic protein, again, that's that insulative covering around the nerve tissue. The mitochondria, your energy production there. So if those aren't functional, energy production. You know, and this is something else I want to point out. Our typical thought process on energy production is that, you know, if I can't produce energy, I'm just lethargic. That's really the main implication of not being able to produce energy. But that's not really true. Every cell in your body has to produce energy to carry out its own role. So let me give you an example. The cells in the gastrointestinal tract, if they can't produce energy, how efficiently can they repair and heal themselves? They can't. The cells in the liver, if they can't produce energy, how efficiently can they detoxify? They can't. They've got, all these cells in the body have to be able to produce energy to carry out their function in the body. Does that make sense? Okay. Your ribosomes, I mentioned that's proteins. And if you, it's both structural and communication proteins is what we're talking about here. Your gangliosides, that's going to be that plasticity or the adaptability of the neurological system, the brain. And then the nucleus, where your gene replication's at. Now, here's a key point I want to make. You can develop autoimmunity in almost any tissue in the body. And what's even more disconcerting about this is that once the immune system has started down this road of dysfunction and it tags one tissue, the likelihood that it's going to pick off another tissue is extremely high. Some of the numbers I've read on this show that the average individual who has an autoimmune condition has on the order of 7 to 8 different tissues in the body that are being affected. So it's not likely that there's just one thing that's being affected. So there's not likely to be just one of these different elements in the body that is being targeted by the immune system. Okay? Now, we got a dysfunctional immune system. We got an immune system that's dysregulated. How do we bring it back into regulation? You memorize this and go tell it to your doctor, right? Not quite. So this is a pretty complex overall diagram, but I want to add some simplicity to it. And actually, it looks complex, but you guys know most of what's up here. Let me just kind of simplify this for you. These are these T regulatory cells. So these are those T cells that I mentioned in the beginning. These are what controls the immune system. These are the regulators. Appropriately applied name, right? They regulate things. So we want these guys functioning as well as possible. Look at some of these names down here. Vitamin D comes into play. This is vitamin D also. They just gave it a synthetic name. Vitamin D. Vitamin D. So vitamin D must have a role in here somewhere, right? Okay. DHA. Where do you guys know DHA from? Your fish oils. So DHA, EPA, that's your fish oil link right there. And then here's gluten, so you can see where those come into play. And then this L-casein and L-reuteri, those are your probiotics. So see, that doesn't look quite so foreign anymore, does it? Vitamin D, your fish oils, your probiotics, and grains. Right? So that's really what this is saying here. That they all have an effect on those regulatory cells. Now let's talk about these individually. So looking at vitamin D here, and I'm going to actually go through and I'm going to give you a visual on each one of these things I'm getting ready to talk about here as far as the role of vitamin D. So if you look at this study says that increasing vitamin D deficiency is being associated with a number of psychiatric conditions, in particular for disorders with a developmental basis such as autism spectrum disorder. Okay, so there's a link. And then what this says is that vitamin D deficiency in early life affects neuronal differentiation. And again, I'm going to show you what each one of these are. Your axonal connectivity, dopamine, and brain structure and function, and can also regulate catecholamine levels. Okay, that's a lot of scientific language in that, right? Let's put it back down into a language we all understand here. So let's look at the first one. So this is neuronal differentiation. How many of you guys have heard about stem cells? Stem cells kind of get a bad name, right? Stem cells are not bad. Stem cells, your body has, basically what a stem cell is it's a cell that hasn't differentiated itself and really determined out what it's going to be at. It's like the college student that just keeps taking classes and never really decides on a major or a career path, right? That's your stem cell, right? But at some point, that stem cell has to make a decision like that college student of what it's eventually going to do. So what vitamin D does is it actually helps these stem cells differentiate into nerve cells, right? So it's needed to continue to proliferate nerve cell generation here. And this is just another diagram saying the same thing. So basically what you've got is you've got an embryonic stem cell, and then it just goes through these different divisions until it gets down into producing the different types of nerve cells in the body, right? That is a vitamin D dependent driven process. The next one we talked about, this axonal connectivity. So if you have one neuron here and another neuron over here, these two can't act independent of each other. They have to be able to interconnect and communicate. And think about it as having a network of friends, and you're trying to achieve something, right? You guys are more effective as a group than you are singularly. That's the way your nerves work too, or your neurons work. They can build, they can function, they can just proliferate faster as a group interacting with each other than they can as a single cell interacting on its own. And what the vitamin D does is that interconnection, it drives that interconnection. Okay? It's like your cell phone. It's your cell phone being able to interconnect and communicate with each other. And then this dopamine. So what this is saying is that vitamin D is responsible in part for how the dopamine regions in the brain function, how they develop is really what we're talking about here. Now, what does dopamine do? And as, again, think about the autistic child and when things aren't ideal for them and them getting upset about stuff or agitated, right? This is the function of dopamine. It's rewards. Your dopamine is responsible for your reward center, your motivation. So your motor function in here. So think about that inability to develop fine motor skills at a faster pace, right? That could be a dopamine-driven process. And then look at this, compulsion. So again, getting agitated for a stimulus that wouldn't agitate us. So what we might perceive as an example, what we might perceive as a lower level sound that is irritating to them may not be irritating to us. But it's that stimulus from the dopamine, it's driving that, okay? And I'm gonna show you how what are known as catecholamines come into play here too. So here's your catecholamines. Catecholamines, the way we all know these are adrenaline and noradrenaline. So if you, or epinephrine, norepinephrine, that's saying the same thing. So if you think about just an adrenaline response as I'm talking about this will all make sense for you, okay? So fight or flight, so that stress response, adrenaline response. When you have an adrenaline rush, does your heart rate go up? Yes. Does your blood pressure go up? Yes. You actually increase your glucose levels because generally you're trying to accomplish some activity, or again, if you're thinking fight or flight, you're running, so you got to supply your muscles with an energy resource, right? So it's driving increased secretion of glucose back into the blood. What I've noticed is that, and one of the things when I did my last presentation with you guys, is that I talked about blood sugar as a factor in this, is that this is one of the reasons as that glucose gets pushed back into the blood.